Hi there, Dr. Ali Miller, and I'm here to talk to you today about assembling your great birth team. So just like any team project at work or any sports team that's going into a championship series, the best team that you have assembled will always result in the best outcome. And it has been shown that women that have a great team of support around them will have shorter labor, they will have less chance of C-sections, less risk of interventions, they will have less postpartum depression after birth, and they will have greater success with breastfeeding. So all in all, assembling your birth team is really, really important. In my office, I always encourage women to really take the wheel and to decide what they want for their pregnancy and their birth, and then to go and pick these team members to be able to support them and their vision. So here you are looking for these right team players. They have to have the right skills. So what are some of those skills you might be looking for in your birth team? Well, first and foremost, I think that you want someone who's empathetic and a good listener, right? So not every woman wants the exact same thing from her pregnancy and from her delivery. So you want someone that's going to listen to what you want, what your goals are. It's okay for them to, offer you suggestions or alternatives. But in the end, you want to make sure that people are listening to what your goals are. The second skill that I find is very important is someone who shares your values and your vision. It can be stressful during a pregnancy if at every appointment you're constantly butting heads on what you want for that pregnancy or for that labor. So again, assemble people that share your vision and your goals. A third important skill I think that's very valuable is having a personal connection with somebody. So again, the earlier you meet these people, you're going to be more comfortable. You're going to be yourself. You're going to really show what you want. Pregnancy and birth can be a pretty vulnerable time for a woman. So obviously, if you have that personal connection, things are going to go a lot more smoothly and a lot more successfully. Team members that are calm are also really important. Pregnancy and labor can be uneasy at times, even scary. So we want to have people around us that are going to be confident and calm and be able to handle situations without adding stress to you or your unborn baby. The fifth important skill that I find is somebody that you trust. So again, assemble that team of people early so that you can build that relationship and you can build the trust and make sure that things are going smoothly. Don't be scared to interview lots of people and also take referrals from friends, family, and other practitioners. So who do you want on that team? First big decision is usually, do you want an OB or a midwife? If you're looking to have a natural childbirth, you probably want to start with talking to midwives. Midwives can help you with your babies delivering at home, in birthing centers, or hospitals. So again, oftentimes midwives will share that same similar natural childbirth value and philosophy. They'll be able to take lots of time with you and care for you before, during, and after pregnancy. If natural childbirth is something you're not looking forward to, then maybe you want to start with an OB in a hospital setting. Again, it's always up to you and what you're comfortable with and what you would like. Another key person that I find for myself when I had my babies and lots of women in my office is having a doula. A doula is essentially a support person before, during, and after labor for a woman. She can provide emotional support as well as physical support. Think about having kind of an extra coach in the room. So it's really helpful if labor is long and your partner needs to be spelled off because they need a bathroom break or an eating break, whatever it may be. This doula can kind of pitch in and help to support you. They can also work with your partner and support you with different strategies and techniques and everything else to make the birth the best experience possible. Who are other team members that you might want on your team? Maybe you want to look to a chiropractor. You can look at a registered massage therapist, acupuncturist. There are lots of personal trainers that work with pregnant women to figure out prenatal yoga or exercise, nutritionists to make sure that you're fueling your body for what you need for your pregnancy. Overall, you want to assemble that right team so that you can have that best experience possible and the best labor and delivery. Good luck.